So how are we helping with overdose prevention? We have two guests on the podcast today to talk about just that. First, Nick Black, an epidemiologist working on a drug sampling project to help us find out what's in the drug supply in Franklin County, as well as any trends that we see in the data. And then we chat with Brittany Walling, who connects FCPH to many of our overdose prevention partners and makes sure they have the resources they need to be successful. All that and more coming up on Health is Real. Come on in, stay a while. Andrew Stinson here alongside Zach Watson. The name of the podcast is Health is Real from Franklin County Public Health. Coming to you today from Memorial Hall in downtown Columbus. Zach Watson, how's it going today?
You know, I could lie and say that it's going well, but I think it's fantastic.
Oh, I see what you did there.
I think it's going fantastic because we have a grade A Hall of Fame. I can already tell he's going to be Hall of Fame guest.
Yes, we do. We have a Hall of Fame guest here today.
You're in the Hall of Fame and you haven't even spoken a word yet.
That's how good he is. Nick Black is here. He is an epidemiologist with Franklin County Public Health. Nick, how's it going today?
Not doing bad. Doing a lot better now that I'm here with you guys.
Hey, yeah, that's what we like to hear.
I also like that he didn't speak until introduced. Like he's a pros pro.
He's a Hall of Fame guest.
He's a pros pro.
Gotta keep my poker face on.
Yeah, he was like not gonna budge. He was like, not say the name first.
That works. So Nick, we want to get to know you a little bit more. Tell us a little bit about who you are and kind of what led you to where you are now here at FCPH.
So Nick Black, epidemiologist, Franklin County Public Health. I've been here for going on almost 5 years in September. Jumped into this work following, being finished in school. The interesting thing is I actually came from the animal side. So I got my doctorate in the College of Veterinary Medicine at Ohio State.
What?
Did some stuff in some biosecurity research in my dissertation related to swine production.
Wow.
Saw this job was open. Now I'm over in overdose and kind of more social epidemiology. And now I'm also have the pleasure of serving as the overdose fatality review epidemiologist here in the county.
I did not know that.
I did not know that. So that's fascinating. And hey, look, you're coming back to your roots because multiple of my dating partners in the past have called me a pig. Now, nothing? Okay.
Nope.
not a laugh.
There we go.
Not one. Well, I've got more. Doctorate of Veterinary Medicine. Listen, I know Nick Black, and he's no Dr. Doolittle. He's Dr. Do-Lots.
That was great.
I'm being taken away. Armed men. Taking me.
I love it.
All right, we're just loosening you up.
Yeah.
No, we're doing good. We're good. So Nick, you mentioned you're in overdose now. For the folks at home who may not know, maybe give us a little bit of background info about this overdose data to action grant and why it's so important for the work that we're doing in that space.
Yeah, so the Overdose Data to Action Grant is a grant funded federally by the Center for Disease Control and Prevention. The current iteration is a 5-year grant. We're moving towards the end of the 3rd year. And basically what it does is it funds prevention strategies to prevent overdose deaths across the country. There are states that are funded and also different localities. We have the pleasure here of having both grants, the first iteration and second iteration. And then as well, we have a few other county health departments in Ohio, Cuyahoga and Hamilton County. So we get to work with them a little bit. But basically, from my end, the data to action, I get to utilize my epidemiology kind of technical trade to look at data, develop as comprehensive a picture I can, kind of situationally, and then inform our program team to inform and kind of direct prevention activities to hopefully save some lives and prevent overdose deaths.
Absolutely. That's great.
So describe the sample collection process we're involved with this year.
Yeah, so one of the main projects outside of just general surveillance and overdose fatality review that I do is I help lead what's called Component B, and that is a competitive strategy that we were awarded in Franklin County. And what that is basically it is a surveillance strategy to collect samples, to so to speak, within your local community, send them off to a lab, and then to identify what different substances are in our local drug market. So the reason why that's important is because it's kind of the wild, wild west nowadays with the drug market. Lots of synthetic chemicals, heroin's not around anymore. A lot of lab work, a lot of different changing chemicals. Things are being mixed in complex mixtures. And so what we are doing right now, we are partnering with a community partner, Hope Resource Center. They have peers that are actually collecting, quote unquote, samples while they are engaging with different participants in the community. And what they're collecting are used syringes. They're now doing as well smoking supplies, straws that are used for drugs, and then as well any kind of used baggies. And what they do is, while they're engaging with individuals, if the individual is willing to participate, they will actually swab the inside of a syringe or those other paraphernalia items, package it up, answer a few questions on a survey about the supply or about the actual drug or substance they use within that syringe or any other paraphernalia. And then we actually send that off to a lab, the National Institute of Standards and Technology in Maryland, to then identify specifically what substances were contained within those paraphernalia products.
That's really quite fascinating. I wasn't sure when you had talked about the collection stuff. My loaded up question was going to be like, oh, what are they collecting? Because and I know, Nick, this isn't for those who are out there who are listening. We collect when we're disease tracking. We do water samples and stuff like that, like to trace what's in sewage, wastewater, and these sorts of things. So
sure.
That's really cool that program exists, and it's also really fascinating that folks who that are willing to volunteer and talk about like that sort of stuff and help give us data points and stuff, which is very, very needed. So
absolutely, yeah, and sort of I know the work is still ongoing with this component B work, but so far, is there anything you can share about what we found so far? Any trends that you're seeing?
Yeah, so far this year, we've collected over close to 500 samples, have about 460 or so that have been tested. We have improved upon our testing. So in the beginning, we were only doing plungers, which are the actual little plunger pieces out of the syringe. Had to do some refinement on how we were doing the sampling because we weren't getting any compounds detected in a lot of those. However, now we've really refined our process and getting a lot of good results. What we're seeing out of the different kind of samples that we are having is it kind of depends on what the paraphernalia sample is, whether or not it's as you can imagine, a smoking product or versus, IV drug use within a syringe. IV drug use, a lot of what we're going to see is fentanyl mixed with meth or fentanyl mixed with cocaine. And then, we'll kind of see mixed products and the other stuff. Some of the interesting results we've seen so far. So generally, we're typically seeing if we do get meth or we do get cocaine or crack, that they answer that was the intended substance that they used. A lot of times we won't see too much mixed in there. So typically the stimulant supply is somewhat pure, and that's kind of talked about across the different sites across the U.S. But then the fentanyl is kind of the Wild Wild West aspect where you're getting a lot of different products, not only different additives or cutting agents, but then you'll also get stuff that is psychologically active, such as now they're mixing in xylazine and metatomidine, which are two veterinary tranquilizers for large animals. So xylazine we're seeing quite a bit in a few of our fentanyl samples. The thing about xylazine that's kind of scary is that it can cause different wounds and kind of necrotic lesions that will kind of pop up anywhere, irrespective of where they're actually using. The other thing with metatomidine is said to be, 100 times more potent than xylazine. And again, this is just a veterinary sedative that's, typically used on horses or large animals. And the scary thing about that is it's adding sedation on top of the other effects of the other drugs. And so even though that they may be used in naloxone, they may be reversing it, there might still be some shallow breathing, or some other effects that are related to the metamine and xylazine that are in the product. Some other things we have found interesting, just this most recent, we identified something called B-temps. I'm not going to try to say the chemical structure, but the actual chemical name, but what that is used, actually, they've identified it, and it's more common in the West Coast, been popping up here and there in the East Coast. But it's actually a chemical used in plastics production that is used to help with UV degradation. And they think it's being found as a chemical precursor to the illicit production of fentanyl.
I think, one of the sort of takeaways is, you have the survey that people take where they tell you what they think is in there, but that's not always what's in there. There's always other things that can be problematic as well.
Yeah, and that's really what we're trying to get at is people typically do not know, I think, the drug that they're using, especially with consistent use, different supplies. You might have a drug bust. Someone else comes in to try to fill that void. There's also a lot more technology when it comes to the lab side. So as it, from a national standpoint and kind of drug surveillance or kind of interdiction within law enforcement, they're always trying to kind of keep ahead of the game. So they're synthetically creating different chemicals to try to stay ahead of the curve, to try to keep changing the market. And so I think a lot of individuals that are using these drugs, they're seeking fentanyl a lot of times, but however, they don't know that there's all this other stuff with it. And then as we were talking about, xylazine with those kind of necrotic lesions, there are a lot of different health effects that can kind of come along with that. And so that's why we do kind of ask the survey or implement the survey as well to kind of get at some of those aspects of drug use. Like, are they reusing syringes? Are they intentionally mixing drugs? And so on the back end, from, a data nerd standpoint, we're trying to interpret it the best we possibly can, but knowing, what are the different nuances and how we're collecting the data to make sure we're actually interpreting the correctly thing. So
absolutely. And you said we work with Hope Resource Center to get the samples in, right?
Yes. Yeah. Great community partner. And we definitely depend on them, partner with them and collaborate with them as the subject matter experts, boots on the ground. These are the individuals that are in the community engaging with these community members. So a lot of times, on our side, I can do my technical stuff with the data and whatnot and try to interpret it the best I can. But if, we don't have those partners that are giving us that, very valuable context of what's actually going on, feedback from participants, making sure that we're also delivering back, what they want as well. It's a very, great collaborative effort, and there's a great partner to have on board.
Yeah, and then I'm sure, Nick, in your role interacting with a wide variety of people, from overdose prevention partners to NIST to local agencies, what do you see from your vantage point that others may not see?
I think from my vantage point, I see a lot of the messiness that kind of comes with data. Mm-hmm. And so, from my standpoint, I really try to distill it down to make it as intelligible as possible. So if I do release things in public, work on a public dashboard, especially with these community members, having the pleasure to work with not only Eric, but, Andrew as well with the communications aspect, really kind of collaborating with individuals on their technical expertise so they can kind of help distill it down in a better way to help communicate the data most effectively. So I'd say I see the messiness. I see kind of the raw aspect of it that others might not see, but we're really trying to work on kind of cleaning things up. And on top of that, I would say trying to really create a system that's efficient and kind of is self-sustaining as it goes along. So, you can create a lot of start talking data nerd stuff, but you can create stuff that's very manual. You have to look into it a lot and whatnot, but trying to create something that is going to be kind of easy to go. So as I continue to get different test results or whatnot, I can just plug that in, update my dashboard automatically. So,
and those dashboards, are those up on the Franklin County CARES website?
They're going to be. So we're finding right now, it should be up this week, actually. So at the end of the week, we're going to have it on Franklin County CARES website, which stands for Comprehensive Addiction Resource Evaluation System, Recovery Evaluation System. Stands for.
There are so many acronyms. It's hard to keep them all straight.
Yes. So it's going to be on Franklin County CARES website, along with our other dashboards. We have non-fatal overdose dashboards, and we also have fatal overdose dashboards on there. looking at different angles of kind of the overdose epidemic, but that will be available as well on there.
Yeah, and Nick, so much of what you and what a lot of your team sort of does in tracking this information and data is it informs our Recover for Life campaign. That campaign works to uproot stigmas that still exist in sort of the space. What are some misconceptions or myths about overdose addiction and recovery that you'd like to address?
I think the biggest one is just the general stigma around substance use disorder and addiction in our community, which I think has really kind of been the catalyst or kind of the underbelly of the beast that's really led to our overdose and addiction problem here in the United States, let alone locally. One thing I really appreciate about the Recover for Life is they took a step back and I think are looking at, how to continue to communicate with and reach youth. And, from an epidemiologist, public health standpoint, we want to look at prevention. So looking upstream and, a lot of these overdose, fatality cases, a lot of times you're going to have a lot of adverse childhood experiences. That's almost a given, trauma, whether physical or emotional. A lot of times it's going to be generational stuff. And I think it's more widespread than we talk about. I think it definitely impacts more people than we like to talk about. But I think there's been a norm in our society to kind of push it down and kind of distance ourselves from it, which I think has created this kind of catalyst to create overdose. So I think in general, from a stigma standpoint, is that I think it affects more people. It can affect anyone. And then I think as well that people that are dealing with substance use disorder are dealing with mental health issues, typically all in together. There are people just like us. And I think that they deserve the respect and kind of consideration of that as well.
Absolutely. Yeah. And I know to your point on the youth, we had Dana Brock on our last episode of the podcast. He's a community member and Recover for Life advocate. And he shared his story. And I feel like a lot of people, it started with those adverse childhood experiences. And he has an incredible story. Go listen to that if you haven't after this one. But yeah, I can definitely appreciate the sort of looking at youth and sort of saying, that's where it starts. We have to get the messaging even to the young folks. Nick, looking back at sort of everything you've done with this work so far, what would you say you're most proud of?
Man, that's a hard one. Could have put me in a spot with that. What am I most proud of? I think my community connections are probably the biggest thing I'm proud of. When I walked into this job, I'd say our epi department was very new. I'd just come out of a kind of a higher level education with that. So all this technical expertise, but looking at the local level, it's very applied. It's very different. What I'm most proud of is coming in and establishing or helping establish these surveillance systems. And a large part of that was really trust building with different community partners. So a lot of it's going to be the data and focusing on all that stuff, but really developing these relationships, I think helping communicate with these different organizations what our purpose was and what we would want to do with the data, what we aren't going to do. And so outside of, I think, of all the technical stuff I've done that I am proud of with projects, I think a lot of it has been the trust building with these different organizations. And I think I've done it pretty successfully. And I just really appreciate, the collaborative aspect I get to really embark in with a lot of these community organizations.
And I'm glad you say that because, a lot of I think what people will get focused on with epidemiologists and your department as a whole and stuff like that is like, oh, they're just, crunching numbers, data. But there's personal, like to your point, there's personal connections and relationships and trust and all these things. Like, you guys aren't just sitting there being quants and just looking at data all day. You're actually like trust building. It's really good. And I want more people to sort of know that.
Absolutely. And I think that's a big thing about with why I have loved this position so much. Again, coming from more of the academic background, coming from the animal side, agriculture, doing some of that research aspect to very applied, very community-based. Local public health is where you actually get to see the change happen. You actually get to see the impact of the work that you're doing. And it's been very purposeful. I grew up to a mom, that struggled with addiction. So have personal experience. It was very purposeful to jump, I think, into this role. But that community aspect, to kind of see the impact of what you're doing, to kind of see the purpose, and not only be, behind the scenes in an academic sense, and looking at the data, crunching numbers, and doing all the nerd stuff, but also getting to be able to connect with these individuals and kind of see the full circle of everything. So it's been very rewarding from that.
Is there anything that you see sort of within sort of the data, the numbers, or how the field is going in terms of overdose and overdose data collection? Are we seeing any sort of new trends on the rise? Like right now, obviously, fentanyl is the big thing. Are we and I know that's a lot of your heavy focus, but are you guys seeing anything in terms of is there a new wave of anything out there substance wise that people should look out for?
Yeah, there's, I'd say a few different trends. When I think people think of drug addiction, they're thinking of needles and they're thinking of heroin. Heroin's not around anymore. Like you said, it's all fentanyl, and people are seeking out fentanyl. There's different kind of groups, risk groups that we're looking at. We're looking at typical users that are going to, maybe seek out fentanyl, maybe opioid users. You have stimulant users, cocaine, meth. They might do that in different senses. But then you also have the experimenters. So the youth, the other kind of pocket that they may do it recreationally, they may experiment. Nowadays, that's why we have this component B, is experimenting is dangerous because you never know what you're going to get. That's why I think we saw such a huge spike, along with other things, in 2020, where we had the highest number of overdose deaths at 803 residents that were lost to overdose. Within this last year, I think we were around 325, 326. And so we're seeing significant decreases. I don't think we're out of the woods yet. I think there's a lot of different things that are at play. We're still kind of looking at the horizon from the standpoint of different substances that we're kind of worried about. So kind of what I was talking about with the complex mixtures of drugs, these illegal organizations are always trying to stay ahead of the game and ahead of the law. And so there's other kind of opioid-like drug classes that they are still, like nitazines is one, orphines is another one that is kind of newer that we're kind of looking out for. As far as trends, stimulant use, at least contribution to overdose deaths, seems to be going up. African-American males are at highest risk of overdose death in our community. And so while we are making strides to decrease overdose deaths in our community, there are still other communities and whatnot that are still being impacted. And then the New American community is something that, the data is really hard to kind of gain insight on some of these New American communities. We have a large Somali community and Nepali community, but they kind of get lumped in a lot of times with demographically. And so wanting to get into those communities, and we're doing some work, within the Overdose Fatality Review to really kind of identify and tease out and continue to work with those communities. And again, reduce stigma and whatnot to kind of help make an impact.
Yeah. And I think the biggest takeaway from everything you just said is just that the work continues and that the work has to continue and it will.
It's good to see those numbers coming down though.
It is. And I think I'm cautiously optimistic. It's obviously great to see those numbers come down. And then I'm also the one that's kind of anxiously biting my nails, watching the trends, just waiting for the next thing to kind of happen. But we're situationed a lot differently than we were a few years back. We have naloxone in the community. I think stigma is being reduced at least a little bit in our community. And, I think we are making major strides. So a lot of our partners and stuff should be proud of that.
Nick Black, epidemiologist here at Franklin County Public Health. Nick, thank you so much for coming on the podcast today.
Of course. Thank you so much for having me.
We have a great guest and someone that I've been waiting to have on for a long, long time. So super excited.
Absolutely. Brittany Walling is here. She is...
Hello.
I don't remember your title. What is your title, Brittany?
That's okay. Hi. I am the Injury Prevention Liaison.
Injury
2,
Prevention.
if you want to get really specific. But
Injury
yes.
Prevention Liaison 2 here at Franklin County Public Health. We've wanted to have you on for quite a while. But first, let's let the audience get to know you a little bit more. Tell us a little bit about who you are and kind of what led you to Franklin County Public Health.
Yeah. So, I don't know how in depth you want me to get?
Like, where were you born? No.
Yeah, right. I was born at 3:54. I'm an Aries.
Okay.
So I got my master's in public health during the pandemic, which was quite the experience, let me tell you. And yeah, that was wild. And so then right after that, I started working at Delaware, their health department, and I was an epidemiologist. And I think I had kind of an understanding of overdose prevention, principles and Narcan. And I remember they were like, oh, on top of being an epidemiologist, we want you to restart our Project Dawn program because it was 2021 during, still COVID. And they were like, we want to get that start going. And I was really excited. So I don't remember when I learned about it, but I was like, yeah, like I'm really excited to, be doing this because, prevention, all of that. And so I started doing that, learned a lot more about it, and started like presenting on it. And then, I stopped working there and I got my job here. So that's kind of like where I started my role.
Absolutely.
Yeah.
And so for the folks at home who may not know, a little bit of background info. I know the CDC's OD2A local grant is something that's really important for the work that we're doing. Can you speak a little bit to that?
Yeah. So this is the second iteration of another overdose related grant. And this one's really cool because it's very holistic. Like it's addressing kind of some key components of preventing fatal overdoses and overdoses in general. So, linkage to care, linking people to the resources and treatment that they need, overdose prevention education and resources. So like Narcan, test strips, things like that. Stigma reduction, which is obviously very important and has held us back, unfortunately, with a lot of great interventions. And then educating healthcare prescribers on the CDC 2022 guidelines. So really trying to target kind of one of the things that led us here in the first place of overprescribing opioids for pain management. So really just educating them on how to balance prescribing and addressing people's pain, but also not overprescribing and kind of perpetuating the issue that's going on. So, and it works it works in the community, public safety, and healthcare. So like three main touch points that people who use drugs would kind of interact with.
Excellent. Excellent.
So let's talk more about you. What does your role look like within the bigger picture of overdose prevention?
Yeah, so my role is basically kind of the middleman between Franklin County Public Health and the partners. So we give out a lot of grant funds to other partners to help us do the work. And I am kind of that middleman. So I meet with certain partners monthly and just make sure that they are meeting the deliverables that they've put on their work plans, asking if they need any help, if there are any resources I can help them find, and things like that. And then just kind of reporting on their work to the CDC when it comes time to send in reports.
Excellent. So what partners do you work most closely with?
Yeah, so right now I work with Unified, and I know you had Kirsten on.
Yes, we did.
Love her.
She's great.
Yes, she's so great. Her work is amazing. So Unified Outcomes, OSU, Wexner, Jordan's Crossing. I worked with Hope Dealers Community last year. I am not their partner this year, and I'm sad. I love them. All of our partners are so great. REACT, the Columbus Fire Division REACT team, OJPP, so the Office of Justice Policy and Programs, so kind of like the programming aspect of people who are incarcerated, justice-involved folks. Oh, and I'm also now working with African American Male Wellness Agency.
Yeah, I mean, if you want to just talk about like sort of the work on the ground that they're doing and how we help them.
Our partners in the community, like Jordan's Crossing and African American Male Wellness Agency, they are working really closely with people who are still using drugs, who are looking to get resources like food, clothes, things like that, insurance help. And they're really focusing on linking them to treatment. So providing them rides, transportation is a huge barrier. So they will work with these treatment providers. And I know that that's a big barrier is like, okay, I want to get treatment, but I have to check my Medicare or my insurance. And, I have to get there. And if I'm an unhoused person, I can't, it's a huge barrier. And so I'm going to be like, maybe tomorrow. And then it might not come. So being able to work with them and help them identify a place that's going to work with them, because not all treatment centers are the same. Some are faith-based, some, have inpatient, all these different criteria. So they work with them to find, okay, the health the treatment center that works for them, the resources they need. They'll check their insurance or they'll sign up for insurance there. They will transport them there. And then when they're there, they will reach out to them and say, hey, how are you doing? They will sometimes send them like little snack care packages and just letting them know that like, hey, you have someone rooting for you back home. And we're not just kind of like, see ya, bye to them. So that's been really, really nice. And I know that that has been a huge successful aspect of like Hope Dealer Community's model. So, and then African American Male Wellness Agency, they're in the community, of course, as well. And they are really big with one of our target populations, Black African American men. But they are really great at, serving that community. It's, people who look like them and, they have that trust, they have those relationships, and they are really pushing out the message of like, hey, this is, we have these disparities in our community and like, we want everyone, and we especially want our Black men and women to be safe and not die. And so like, here are these resources. They have a campaign of, it's our problem too. And they have just built amazing resources and connections. They are teaching Narcan administration in barbershops and like salons and, corner stores and things like that. Like they're just literally everywhere and it's amazing. I love them. People like REACT and OJPP, Office of Justice Policy Programs, they are working. So REACT works a lot with people who had an overdose. It wasn't fatal. They refused EMS transport and they just follow up with them. So they, someone overdoses, they don't want to go to the ER. They get that information through their systems, communicating with EMS and things like that. And then they go and visit them and they're just like, hey, how are you doing? They give people Narcan. They have like a social worker there. They go plainclothes officers. I've been on a ride along with them and I love them. It's very like, I don't know, chill is the word I'm thinking of, like very non-threatening. Because you think like, okay, fire, maybe they have some police officers too, like showing up to people who just use drugs, like may still have some on the property. That can be scary, but they're just like, hey, we just want to make sure you're okay. We want you to know, like, are you interested in treatment? If you are, we can take you there. Right now, they're kind of doing similar things of Jordan's Crossing, where they will identify a place to take people, transport them, and kind of like follow up with them as well. So I love them. And they're also doing a lot of trainings and just helping to like reduce that stigma, especially in like the law enforcement EMS world. OJPP in the jails, they're helping to connect folks who are incarcerated to medication-assisted treatment. So if they come in and they, indicate that they were using substances, they will hook them up with medication, Suboxone, Vivitrol, things like that to help them manage cravings and just kind of, give them the medical care that they need. They also do like overdose prevention education sessions to people who are in there who had like drug-related offenses. And then they're also working with those people before they're released to find them continuing care. So, you're on MAT right now, medication-assisted treatment. You're on MAT right now. Well, when you get out, let's find you some providers. And then when they get out, they have them follow up with the navigators at OJPP and, just kind of help them. They give them like a gift card as an incentive too, which is nice, especially if you're someone who is just incarcerated and you don't have a job, being able to, hey, come in, like follow up with us and let us know how you're doing and if you got care. And here's a gift card to go, get some basic needs met. So I really do love them. They do such amazing work. And then OSU, Wexner, they are working with people who are in the hospital. People come in maybe for an overdose or other related health conditions and might be related to their substance use. And they have peers working with them to basically similar, just connect them with resources, have someone, especially if it's a peer, having someone in the hospital, which can be a really scary place. That's like, hey, I'm not judging you, because as we know that the stigma in healthcare is very real, especially for people who use drugs. And so, having someone be like, hey, I've been where you are. I'm not judging you. All I care about is you getting the help you need. If treatment isn't in your plan today, like that's fine. I just want to see, can I help you with insurance? Can I help you with food? Can I help you with literally anything else to make your life easier? And then, when you're ready, you can come back and you have a friendly face at OSU. So.
Absolutely. Yeah. So many great partners. And I just want to quickly mention,
so many.
If you haven't already, check out the episode we just released with Kirsten Buckner. She had a lot of great things to talk about unified outcomes and what they're doing. So after you listen to this one, go check that one out too.
Or else.
Or else.
Or Zach will be angry.
I
with
will
you.
find you.
Yes. Yeah, they're one of my partners as well, but I won't even go listen to them because I will let Kirsten explain all that she does because she will do it in such a much better way than me. So her passion is just, I'm sure you felt it when you were recording with her.
Yeah.
Her passion is just like electric.
Absolutely.
Yes.
Absolutely. We have a lot of really good partners.
We
with
do.
OD2A. And so then your role is to be that connection, right, between
Yes.
Franklin County Public Health and the work that they're doing.
Yes. So I'm meeting with them and I'm like, hey, how is your campaign? How is this? How many, your events? And they'll tell me and I'll be like, is there anything you need? Or they might be like, oh, we're having an issue with this. And I'll be like, oh, I was just talking to Jordan's Crossing and they were having this and this is what they did. Let me see if I can connect you. And so it's really helpful to be there and, be able to kind of like help them because a lot of these agencies, especially the grassroots boots on the ground organizations, don't have a lot of the manpower that some of the other like government or more securely funded places do. So it's like I like that I can help ease a little bit of all of the things they have on their plate and be like, hey, let me help you with that. So
And then sort of connected to that, I'm sure in your role you're interacting with a wide variety of people. You've sort of already hinted at that sort of thing. Whether it be partners, community members, to other local agencies. What do you see from your vantage point that others may not see?
Yes. So one thing I'm, seeing is just the passion and the effort that all of the people who are at these different agencies are putting in and just like the toll that it takes on them. But also just their resilience, especially navigating all of these, this uncertainty, these cuts, things like that. A lot of these organizations really rely on that. And so they're just very resilient people. And I've seen them be like, hey, this is really detrimental, but we're going to push through because these people need us. So I think that being able to witness that kind of like on the behind the scenes has just been so incredible. I have also seen the disconnect between a lot of the resources that we have in our county. There's like a saying that's like, we're resource heavy, but like connection poor, or something along those lines. Basically just saying we have a lot of resources, but because we're so disconnected, it's really hard for organization A to talk with organization B about a patient. And so people can fall through the cracks. But and I'm sure a lot of our partners would also admit and like acknowledge that because it's a very real barrier that they themselves also deal with, but they are also so dedicated to trying to find ways to like connect all these organizations and make sure that people know about all of these amazing resources that we have.
So the Recover for Life campaign works to uproot the stigmas that still exist in this space. What are some misconceptions or myths about overdose, addiction, and recovery that you'd like to address?
Oh my gosh, yes. I think it's also important to recognize that we as a society have made some great strides in reducing this stigma. So I just want to say shout out to everyone who's been able to change their mind or learn new information, because that's just the key to progressing, is being like, hey, I didn't know this and now I do, and I've changed my mind. Love that. One of the big misconceptions or stigmas is thinking that Narcan is aiding and enabling. I hear that a lot when I'm in the community is, oh, well, I don't want to enable someone. They're just going to keep doing it. And, when I was thinking about this question, I thought about that saying of, it's like fall 7 times, stand up 8 kind of.
Mm-hmm. Yeah.
Well, I think that really speaks to the fact that, in life, especially with addiction and substance use, relapse is part of recovery, and people are going to struggle and use and possibly overdose and kind of quote fail. I don't like to say fail, but just struggle. Mm-hmm. But if we aren't able to save someone with Narcan, then they're not going to be able to get up that 8th time. It's really difficult. And, some people might need more quote failures or lessons or falling down more times than other people before they're truly able to make change. I like to say that the only thing Narcan enables is breathing. So, and then another one is when we're out in the community and we're giving Narcan, a lot of people, when we're offering it, they will immediately be like, oh, I don't know anyone who's using drugs, or like, I don't use drugs. And so I would love to challenge the notion of the people who are using drugs and need Narcan used on them can't use it themselves. So it's really up to all of us to have it in a potential situation, I always say it's like better to have it and not need it than need it and not have it. It's kind of like an AED or a fire extinguisher. You don't have a fire extinguisher because you anticipate lighting your house on fire. It's kind of the same thing with Narcan. And even if you don't use it, you never know. It's not just illicit substances. It's grandma who might have forgotten she took her medication and took too much. It's little Jimmy got into, the medication in the cabinet that we thought we locked and we forgot because it's a busy morning. There's just so many, or your dog. It's actually, you can use it with animals too, which is wild. You don't need to know someone who's using drugs, and you yourself don't need to be using drugs to have Narcan.
Yeah, I feel like sometimes the notion is like, well, that's a problem for those people or them over there.
Yes.
And what you're saying is, no, this is something that can affect everyone.
Everyone. Yeah. Yes.
And I think that's great. I mean, and that probably speaks to campaigns like Recover for Life who are pushing this anti-stigma message. So it's good to know that, there is progress being made. Still a lot of work to do, of course, but a lot of progress being made. So, Brittany, looking back at everything you've done so far in this work, what would you say you're most proud of?
I'm proud of a lot. I'm really proud of helping to secure this second iteration of grant funding. When I started here, it was in the extension year of the first cycle. And so I was able to help write, the application. So hair flip. I was really excited about that.
I'm sure was there a lot of people also working on that?
Yes, yeah. It was definitely not just me. Shout out to everyone who was part of that. But also the opioid one box project that I've been able to implement. So the one boxes, they're like a box that comes with this flap that when you pull it down, it's an instructional video that takes someone through how to administer Narcan if you're in an emergency. So like when you pull it down, it's this adorable woman and she's like, first off, let's take a deep breath. Like, I love it so much. I've heard it so many times. I'm like, I can hear it. So I love that. She's like, first of all, let's just breathe. Like, because we're panicking. I would be panicking. So I love that it just walks you through it. There's also written directions just in case. And then there's also a Spanish option, which I love. So there's that. And then, of course, we supply the Narcan, FCPH does. And then it also comes with CPR shields because we know that rescue breaths are really important for overdose prevention, just that lack of oxygen. And then there's alcohol wipes and some gloves. So there's also like a little training aspect as well, like a training video. But I just love it because it's, just another resource and just on-demand training. So getting those in school districts, we've done about 3 so far. We're hoping to expand. And then my last thing that I'm proud of is my ability to learn information that was maybe different than what I previously thought and be like, you know what? That actually makes sense. I'm able to change my mind. And because I feel like that's a huge part of the stigma is being able to see someone that you maybe thought like, oh, they just have low morals, like they just don't want to be sober, all that stuff. And then to like learn that like, hey, this is, a disease, this is a condition, this is something that involves a lot of chemistry and, things in your brain, and environment is a huge aspect. And just learning all these things about substance use and then being like, you know what, I actually have a little bit more empathy. I don't know. I just think that that's a really strong quality in people. And I'm proud that I've been able to do that. Not perfect for sure, but.
No, that's great.
No,
that's great.
Yeah, agreed. Yeah. Huge quality.
So, Brittany, is there anything that folks listening can do to help?
Yeah, I would say if you haven't gotten Narcan already, we have free mail order on our website. Definitely check that out. I would say if you are in a space where you can be around people who are using drugs, volunteering at a place like Equitas Safe Point or Jordan's Crossing or Hope Dealer Community, really just showing some love to that community because they've been, very neglected in history. And just kind of educating yourself and really questioning any biases you have. We all have biases. We all have, things we've learned from society, but it's important for us to acknowledge them and address them and not be like shameful of them and just be like, hey, I had this weird feeling when I interacted with someone. Like, let's dive into that. But yeah, and just really encourage other people if you hear people saying things like, oh, it's just enabling, or if anyone is spouting some misconceptions, just kind of challenging them in a kind way of just being like, hey, let's learn together.
I like that. Challenge them, but in a kind way.
Yeah. Because like we don't know what we don't know. And when someone's trying to come at me, I know when someone's trying to come at me and correct me on something, and if they're aggressive about it, I might be like, oh, actually, I'm not going to listen to you at all.
That's right.
Yeah.
But if they're approaching it as like, hey, I just learned this. So like, do you know? Even if you learned it like 10 years ago, you can be like, I just learned this yesterday. Like, because then it makes someone feel less like, oh, I'm out of the loop, you know? So I don't know.
Let me try. I just learned this yesterday. Andrew's a bad guy.
Oh, no.
Oh my God. I didn't know that. No.
Just yesterday you learned that. Wow. It took you a while, Zach.
Right? That's actually a good thing. No.
He's a dastardly man.
Yeah.
It's like
Well-
the guy at the train tracks tying a woman up just with a twisty mustache every day.
Well, we've really gone off the rails there, Zach.
Oh,
Boo.
Oh, here we go. There we go. I was a little slow on the rim shot.
okay. I love that.
All right. Brittany Walling, Injury Prevention Liaison here at FCPH. Thank you so much for coming on the podcast, Brittany.
Oh my gosh, thank you for having me. I've been so excited to do this. So thank you so much.
Thank you for listening to the Health is Real podcast from Franklin County Public Health. Want to chime in with your thoughts? Email us at fcph@franklincountyohio.gov. And did you know our Recover for Life campaign is a resource for people interested in substance use recovery in Franklin County? We know addiction is a disease impacting thousands of people in our area, and we're helping our community recover. Visit franklincountyrrecovers.com to learn more.